Efferalgan tablets has analgesic, antipyretic, and extremely weak anti-inflammatory effects. The drug does not adversely affect the water salt metabolism, sodium and water retention, and the gastrointestinal mucosa. Indications: as an antipyretic for acute respiratory infections and other infectious and inflammatory diseases, accompanied by an increase in body temperature. As an anesthetic for pain syndrome of mild or moderate intensity, arthralgia, myalgia, neuralgia, migraine, toothache and headache, algomenorrhea, pain in injuries and burns. How to use? The drug is taken orally. The tablet shall be dissolved in a glass of water, 200 ml. Do not chew or swallow tablets. Usually used 1 to 2 tablets 2 to 3 times per day at intervals of at least 4 hours. The maximum single dose is 2 tablets, 1 gram. Maximum daily 8 tablets, 4 grams, which corresponds to a single dose of 10 to 15 mg per kilogram of body weight. The maximum daily dose is 75 mg per kilogram of body weight. As a rule, there is not need to exceed the recommended daily dose of paracetamol, equal to 3 grams. The daily dose can be increased to the maximum 4 grams only in case of severe pain. In case of impaired renal function, the time interval between doses of the drug should be at least 8 hours with a SSC of less than 10 ml per minute, at least 6 hours with a SSC of 10 to 50 ml per minute. In patients with chronic or compensated active liver diseases, especially those accompanied by liver failure, in patients with chronic alcoholism, chronic malnutrition, insufficient supply of glutathione in the liver, Gilbert's syndrome, hereditary hyperbilirubinemia, dehydration or body weight less than 50 kg. The dose of the drug shall be reduced or increased interval between doses. The daily dose should not exceed 2 grams, 4 tablets. The drug should be used with caution in children and patients weighing less than 50 kg to eliminate the risk of exceeding the recommended dose. The dosage regimen in children over 12 years of age and weighing more than 43 kg is the same as in adults, while the interval should preferably be 6 hours, strictly at least 4 hours. The duration of admission without consulting a doctor is no more than 5 days when prescribed as an anesthetic and 3 days as an antipyretic. Contraindications: severe liver failure or decompensated liver disease in the acute stage, sucrase, isomaltase deficiency, fructose intolerance, glucose galactose malabsorption, children up to 12 years old, hypersensitivity to paracetamol, proparacetamol hydrochloride or any other component of the drug. Use during pregnancy and lactation. The use of the drug in the first and third trimesters of pregnancy and during lactation, breastfeeding, is contraindicated. Special instructions: in order to avoid overdose, the content of paracetamol and other drugs that the patient takes simultaneously with Efferalgan should be taken into account. Taking paracetamol in doses higher than recommended may cause severe liver damage. With ongoing febrile syndrome against the background of the use of paracetamol for more than 3 days and pain syndrome for more than 5 days, a doctor's consultation is required. To avoid toxic liver damage, paracetamol should not be combined with the intake of alcoholic beverages and should not be taken by persons prone to chronic alcohol consumption. Side effects: when using the drug, the following side effects were noted. Frequency not established. Allergic reactions, hypersensitivity reactions, pruritus, rash on the skin and mucous membranes, erythema or urticaria, angioedema, erythema multiforme exudative, including Stevens-Johnson syndrome, toxic epidermal necrolysis, anaphylactic shock, acute generalized exophthalmosis pustulosis. From the respiratory system, bronchospasm. From the site of the nervous system, when taking high doses, dizziness, psychomotor agitation and disorientation in space and time. From the digestive system, nausea, diarrhea, epigastric pain, increased activity of liver enzymes, usually without the development of jaundice. Hepatocnecrosis, dose-dependent effect, hepatitis, tenesmus, liver failure. From the site of the kidneys and urinary tract, increased creatinine. From the endocrine system, hypoglycemia up to hypoglycemic coma. From the hemopoietic system, anemia, cyanosis, sulfur-hemoglobinemia, methemoglobinemia, shortness of breath, head pain, hemolytic anemia, thrombocytopenia, neutropenia, leukopenia. Others: decrease in blood pressure as a symptom of anaphylaxis, changes in prothrombin time and international normalized ratio.